Hair loss can be a very devastating experience for both men and women. My name is Vic Khanna. I'm a board-certified dermatologist and hair transplant surgeon. I deal with hair loss in both men and women, and I notice a difference when men and women may come in. We see a lot of women coming in early in the hair loss process, expressing their concerns and wanting to initiate treatment. Men, however, may wait a long time before they come to terms with the hair loss and come to terms with it being a problem. They may have noticed it. The average man waits 7 years from the point that he starts noticing hair loss to come in for querying about any possible solutions. A number of treatment options, including medical therapies and hair transplantation. Here at DSI, we specialize in the ARTAS robotic hair restoration system to deliver excellent results and very precise results. Hair has 3 basic phases in its growth cycle. The anagen part of the cycle is the growth phase. It's the active growth phase of hair. That's the phase in which our hair grows very long in length. It needs to be cut, trimmed, and styled. But then after that long growth phase, it goes into a transition or resting phase called catagen. The catagen follicle is neither growing nor shedding at that point, but it's transitioning into a shedding phase called telogen. About 15% of our hairs at any given time on our top of our head are in the telogen phase. That telogen phase is the shedding phase, and that's the hair follicle changes its configuration, its shape, and the hair sheds out. With modern medications, we can extend the anagen or growth phase for a longer time. We can do that with injectables or various new classes of medication. The anagen phase, the hair growth, may shorten in response to various hormones, DHT that's accumulating in the skin, leading to less blood flow to the hair follicle. When that anagen phase is changing like this, the caliber of the hairs becomes thinner. So the diameter of the hairs becomes thinner, finer, eventually more downy, and they can give the appearance of a smooth, balding scalp. We want to preserve the hairs before they miniaturize over subsequent growth and shedding cycles. So it's real important to either get started on medications, trending towards beyond that point, maybe initiate the process of the hair transplantation procedure. Hair restoration or hair transplantation has 2 main procedure types. There's the FUE and the FUT procedure. The FUT procedure was the older procedure, or often called the strip method. This is a method where the hair is harvested from the back of the scalp. Those hairs are genetically predestined to last longer. They have less concentration of a certain enzyme and less responsive to testosterone's conversion to dihydrotestosterone. Those hairs that are more permanent are then removed in a big strip. It's sutured together or stapled together and then dissected in the office the day of the procedure. And then those individual grafts are planted into areas where the hair is wanting to be received. Then the FUE procedure is when you take individual hair follicular units, and those individual little clusters or individual hairs are removed precisely, and there's minimal scarring with this procedure because incisions are extremely microscopic, and then those individual hair clusters or groups are planted into the scalp. This allows for a much more finessed and elegant hair transplant that looks very natural. The FUE procedure can be done manually, so it can be done by technicians by hand, both the harvesting and the implantation, or it can be done robotically. In our office, we specialize in the robotic hair transplantation. This is the most superior of all methods, where the harvest is done by a robot using AI technology to target and harvest at the precise angle. And it makes it so that we don't waste any hairs. Very few hairs are transected. We get the best yield from doing this robotic hair transplantation or robotic FUE procedure. I'm a big fan of that procedure. When I trained 25 years ago, the FUT procedure was most commonly in use. And I trained under one of the most world-renowned hair transplantation surgeons, and still to this day he is one of the most renowned hair transplant surgeons, but he still uses the FUT procedure. That procedure, I was impressed with some aspects of the results. However, it often left a very prominent scar in the back of the scalp. And this, to me, really discouraged me from wanting to deliver that procedure in my practice. Now, with advances in technology, and now especially with the robotic advance, we get extremely great results, and our donor site looks good and our recipient sites look excellent. The healing time is so minimal. The incisions are so small that in 48 hours everyone's healed, and the pain is very minimal too. No one needs usually more than a Tylenol the night of the procedure, and many people tell us they didn't even take that. So it's just exciting, great results we get from the modern robotic FUE procedure that we offer at Dermatology Specialists of Illinois. Hair loss is a very emotional condition for both men and women who suffer from this condition. And that's the impact of a well-done, natural-looking hair transplantation procedure. It can really restore the confidence that we lose as we lose our hair. There are 3 stages to a hair transplant procedure. The initial harvesting from the donor site, so that's usually taken from the back and sides of the scalp. The site making is the second stage, where we create the sites where we're going to implant the hairs. And then finally, the implantation phase. And the beauty of the ARTAS robot procedure is in each of these 3 stages, it delivers superior results to any other form of hair transplantation. The robot combined with the AI is able to approach the follicles perfectly at the right angle and take out individual follicular units. This leads to less scarring, precise harvesting, and a lack of injury to those hair follicles. We may create the sites with the robot. It implants them at the perfect angles, which we program in. We scan your scalp into the computer and we tell them exactly the angles we want every hair transplanted. And it does, and it delivers it perfectly every time. Prior to the hair transplantation, there's not a whole lot you need to avoid. For a week prior to the procedure, I would try to get a little bit better sleep. I would avoid any blood thinning medications if we can get off of those. I would avoid drinking excessive alcohol for the week prior to the procedure. Many people are candidates for hair transplantation. However, it's really important though to see a dermatologist first and get an assessment of what's really going on. You can tell pretty quickly as dermatologists whether or not this is male pattern hair loss or not. There could be other coexisting processes as well. There could be other skin diseases that might be playing a role, or autoimmune conditions or inflammatory diseases. Either way, the first step in getting towards hair transplantation is a consultation with a dermatologist. Hair transplantation has few contraindications. Most people who have male pattern hair loss are going to be candidates for this procedure. It's actually, I think people sometimes are surprised at how easy the procedure is. When the patient comes in early morning when we start the procedure, the area is anesthetized, and there's not a lot of pain medication given because people don't really experience a lot of pain. It's done in one day. Many times the patients are sleeping for half of the day while they're here. While the machine is working on them. What does a hair transplantation typically cost is a common question that people have. And it really varies. It depends on how much hair loss you have, and so how many hair follicles will need to be transplanted. And if you just have a mild or moderate case of hair loss, you might be somewhere on the $7,000 range. But if you have more extensive hair loss, it can be upwards of $18,000. Don't worry too much about the cost because financing options available in the office, and most people can restore their hairline permanently for under $300 a month. Everybody seems to feel like it's worth it. Come in for a consultation so we can at least talk to you about what, if anything, we can do for you, and then estimate how much it's going to cost and arrange for financing if you need it. The hair transplantation procedure usually is done in a single day. Patients come in the morning and they leave by mid-afternoon typically. Gives them a lifetime of permanent hair because the transplanted hairs are going to last forever. So the procedure itself flies by for patients. We give them a local anesthetic, so some injections in the recipient area initially, and then eventually in the donor site. We might give them something to relax them a little bit. That's usually why they sleep through most of the procedure as well. It goes very smoothly, and it's very rare that we would need to do multiple sessions. Most of the time we start right in the front. We restore the frontal hairline, and then we move back from there. And if someone has a very extensive hair loss, it could be a situation where we might need to do some additional transplantation. But the vast majority, it's a single day procedure, and it's essentially painless. After the hair transplantation is not that much that you need to do. We kind of baby the hairs for a couple of days. It's important not to dislodge the grafts before they've attached to your native blood supply. So by day 4 or 5, people are feeling great. It's just that first few days, we kind of take it a little easy. The success of hair transplant is very high. With the ARTAS robotic hair transplantation system, which is so gentle, we have a very high success rate. So 98% of the grafts that are transplanted are going to survive in their new spot. So that's an extremely high percentage compared to manual or other FUT procedures. It is the best way of transplanting these hairs. So we have high success rate, and the patient satisfaction rate, by the way, is really high as well. Hair transplantation is a permanent. We're going to move those hairs and they're going to permanently survive where we transplant them to. So you're going to have decades of success. It's also important to maintain the hairs that are behind the transplanted areas as well. We don't want them progressing into hair loss as well. So there's going to be an important maintenance phase of this as well. And this is why it's important to get treated by a dermatology practice, because we can do the transplantation. We also can maintain the hairs with various treatments to the hairs from even thinning out behind the transplanted hairs. So the optimized results with transplantation and then the maintenance phase.